Depressive disorder not otherwise specified is the third type of unipolar mood disorder. It shows minor depressive disorder having episodes of at least 2 weeks of depressive symptoms, but with fewer than the 5 items required for the major depressive disorder. It also shows recurrent brief depressive disorder or depressive episodes lasting from 2 days up to 2 weeks, occurring at least once a month for 12 months. It may also be a major depressive episode superimposed on delusional disorder, psychotic disorder not otherwise specified, or the active phase of schizophrenia. Situations in which the clinician has concluded that a depressive disorder is present but is unable to determine whether it is primary due to a general medical condition or substance-induced.
Now I'm here to talk about bipolar disorders. It should be noted that all bipolar disorders abide by the following characteristics. They are not substance-induced, nor are they induced by medical condition. They are not due to schizophrenia, schizoaffective, or delusional disorders. They all cause clinically significant distress or impairment in functioning. Now, bipolar disorders are divided into 3 classifications. Let us start with the first one, which is known as the bipolar 1 disorder.
My other friend RJ was diagnosed with bipolar 1 disorder, and when we went to his place, me and his other friends, we believed he was in a state of mania, he had a manic episode. Me and his other friends were frightened because he was overly confused. He didn't know what he was saying, and he couldn't stop laughing. Then we learned after that after that episode, he went back to his normal state. So we visited him then 2 weeks later. But then when we went there, we found out that he was overly depressed. He was in a catatonic state, and he was disabled. He hardly said a word, and I believe after that he was brought to the hospital.
Bipolar 1 disorder is characterized by the occurrence of one or more manic episodes or mixed episodes. Often, the patient has had one or more major depressive episodes. Bipolar 1 disorder is a recurrent disorder where more than 90% of individuals who have a single manic episode go on to have future episodes. Recurrence is defined as either a shift in polarity of the episode or an interval between episodes of at least 2 months without manic symptoms. A shift in polarity is in which a major depressive episode evolves into a manic episode or a mixed episode, or in which a manic episode or a mixed episode evolves into a major depressive episode. Bipolar 1 disorder can be divided into 6 separate criteria sets. The first would be single manic episode, which is used to describe individuals who are having a first episode of mania. The remaining criteria sets are used to specify the nature of the current or most recent episode in individuals who have had recurrent mood episodes. These are the following: hypomanic, manic, mixed, depressed, or unspecified most recent episodes. With regards to sexual predisposition, it must be noted that bipolar 1 is approximately equally common in males and females. Bipolar 1 disorder can also be associated with other mental disorders, such as anorexia nervosa, bulimia nervosa, attention deficit hyperactivity disorder, panic disorder, social phobia, and substance-related disorders. The next classification of bipolar disorder would be bipolar 2 disorder.
My other friend Mark is diagnosed with bipolar 2 disorder, and different from bipolar 1 disorder, he did not experience a manic episode, but he had experienced, I think, a major depressive episode in the past. And instead, bipolar 2 disorder, I believe, is characterized with hypomania, which is not severe enough to cause impairment, nor requires hospitalization to ensure his safety. From what his mother told me, his attitude is that he displayed persistent elevated emotions and it got irritated at times. But this is very distinct from a non-depressed mood. And he showed a decreased need for sleep. He became more talkative and less shy. He became easily distracted and had extreme desire for pleasure.
Also known as recurrent major depressive episode with hypomanic episodes. It features the presence or history of one or more major depressive episodes and at least one hypomanic episode. One important characteristic would be that there has never been a manic episode or a mixed episode. Other associated mental disorders with bipolar 2 are the same as those found in bipolar 1, with the addition of the borderline disorder. The third classification of bipolar disorder would be cyclothymic disorder.
My neighbor Miguel was diagnosed with cyclothymic disorder, and from what I know, it's a chronic fluctuating mood disturbance that's characterized with numerous hypomanic and depressive symptoms. And I had known that for the past 2 years he had not experienced any major depressive or manic episodes, and instead again his condition is characterized with numerous hypomanic and moderately depressive episodes. His playmates tell me that he can get really excited, playful, and really energetic, but then at times also he can get really tired, restless, and helpless, and outright pessimistic.
Cyclothymic disorder, which is defined as a chronic, fluctuating mood disturbance with numerous hypomanic and depressive symptoms. The hypomanic symptoms would not be able to meet the full criteria for manic episode, while the depressive symptoms would not meet the full criteria for major depressive episode. The criteria for cyclothymic disorder are the following: 2 years with lots of hypomania and depressive symptoms, 1 year in children and adolescents. In the period stated, the patient should not be without symptoms of the hypomania and depressive episodes for more than 2 months. There must be no major depressive episodes, manic, or mixed episodes in the first 2 years. Presence of cyclothymic disorder is equal in men and women, but women are more likely to present for treatment. The disorder is often onset in adult life.
So we have 2 kinds of disorders, of mood disorders. We have bipolar disorder and depressive disorder. But we also have 2 other types. One which is the substance-induced one, and the other one which is due to a medical condition. So mood disorders due to medical condition. For example, an individual has a heart attack or a stroke or whatever that handicap scheme. He would have this learned helplessness because he would become hopeless that he won't get cured anymore, and that would eventually lead to depression. And the other one, which is mood disorder, which is substance-induced, is caused by intake of heroin, steroids, methadone, or other such drugs. So basically, the symptoms are the same, but the causes are different.